我亦都係 external examiner to the Malaysian system。佢哋嗰個 system 就係一個 master degree 嚟嘅，就係一個6年嘅 program。咁當然 American board 同埋 the British FRCS system 都係 well known to most of us。咁最後有一個叫做 International FRCS 咧，係2年前開始搞嘅，喺斯里蘭卡係一個叫做 International FRCS Surgical Neurology。咁就我都喺嗰度考過2次 as an external examiner。咁嗰啲candidates 咧傾向於係more mature， 咁佢哋都40歲人 beyond 嘅，咁係好 experience 嘅 cutting neurosurgeon 嚟嘅。咁 it's a pleasure to be examining them， 就唔使我哋真係好似問好多問題啦，即係問少少嘢佢就你要停佢講得太多嘢嘅，otherwise就過晒時啦。So that's the background， 我拎出嚟同大家 share 嘅。咁大家都知道surgeons 嘅 training 就係一個 apprentice system。咁但係隨住時間咧，就training 如果係真係師傅教徒弟咁樣咧，可以 take many years。咁但係依家嘅時間係寶貴嘅，特別係嗰個work hours 係由100個鐘頭至到喺美國就85個鐘頭啦，就喺香港就65個鐘，英國同埋歐洲就48個鐘。咁少咗時間，我哋就要 more efficient。咁所以啲supervisor 同埋一啲candidate 同埋啲 residents 依家都係好聰明地利用少咗嘅時間去學得更多嘅嘢，因為training material 係的確係好多嘅。咁呢張 slide 先係今日我哋最重要嘅 slide， 就係因為你哋喺呢個階段咧，Med 6就啱啱考完 MBBS 或者 MBCHB， 咁就係會做1年嘅 internship。咁呢年嘅 internship 咧，我哋希望即係你哋有興趣做 neuroscience 嘅人，不論你係想做 neurologist 或者 neurosurgery 或者係 neuroradiologist， 都做6個禮拜嘅internship in neurosurgery 會幫到大家認識多啲 clinical neurosciences。就咁你如果決定係做neurosurgery 或者 neuroscience related 嘅咧，咁如果你哋可以喺開頭嗰2年係做到6個月嘅 neurosurgery， 咁就不論你將來係想做 surgeon 或者想做 radiologist， 咁呢1年呢6個月嘅 neurosurgery 係會學到好多點樣去 request imaging， 點樣去 interpret imaging in an emergency setting 係會好有用嘅。咁如果呢2年咧，呢2年嘅意思其實即係4個specialty。咁通常最 standard 嘅就Danny 同埋都做過最理想嘅 rotation 就會係1年 general surgery， 1年 orthopedics 或者 A&E， 就唔係1年就6個月啦，6個月general surgery、orthopedics、pediatric surgery 同埋 neurosurgery， 咁4樣做過咧，咁你就會考埋個 MRCS 咧，就會 equip to enter 一個neurosurgical residency training。咁呢個咧係我哋有一個好 serious 嘅，都好 intensive 嘅 recruitment exercise， 就包括問3條都幾深入嘅問題，即係你了唔了解你自己啦，你喺一個 emergency situation 點樣解決一啲 clinical 嘅問題啦，同埋最後一個我都唔記得咗。嗰啲通識問題好似可能問新冠病毒嗰啲結構啊咁嗰類嘅，就咁另外咧就有一個 hands-on 嘅，可能有時會係轉雞蛋殼，有時會係轉啲骨，有時要連針啊咁樣嘅。咁如果你 pass 呢一個 assessment 咧，就會 enter 一個5年嘅 training。咁我哋依家每年係收以前收2個，跟住就我哋都唔夠人用，所以就收4個。咁今年就想收5個嘅。咁我哋5年嘅 rotation 咧，就第1年咧就喺翻 parent unit。college 嗰個 requirement 咧就係你係需要 rotate outside your parent unit for at least 1 year。咁我哋 neurosurgery 就決定想大家嗰個有多啲 variety， 所以我哋希望每個人都 rotate 2年係 outside your parent unit。最後嗰2年咧就喺翻自己 parent unit。咁之後咧就考到試就做夠5年就係 specialist。做咗 specialist 做多2年咧，你可以 apply to be a trainer。 咁 as a trainer 有個好處就係你識得教人，就自然係會你做嘅工作會更加滿意同埋更加有 confidence 嘅。咁所以 that's the whole idea。咁係啦，即係如果你記得呢張 slide 就知道點樣去 get into neurosurgery， 或者如果你做過 neurosurgery， 你覺得都冇興趣嘅，但係你做咗嗰6個月咧，其實係將來你做A&E 或者做 physician as a neurologist 或者做 radiologist 都會好有用嘅。咁其他嗰啲slide 就係 you just go through it very quickly。咁香港嘅 system 咧就我哋要求你做夠5年啦，就喺第3年半嘅時候考試。就我哋都會 assess 嗰啲 index 嘅 operation。咁每年開頭嗰3年每年會 assess 2個手術，你要同你嘅 supervisor 或者 trainer 一齊做，個 trainer 覺得你都掂啦，咁你先至 OK。咁你要起碼有2個 operation 係 satisfy 到你嘅 trainer 嘅。咁呢個就係一個最能夠make sure 你嗰個進度係 satisfactory 嘅。咁就另外咧要喺嗰4年之內咧就要有2個research project 係個 abstract 係經過 research committee 係 approve 嘅。咁呢個都係一啲唔係難嘅嘢嚟嘅。咁主要係唔係想你做一啲 original research at a very high level, but to gain the research experience rather than to be an innovative clinical investigator. OK， 咁就呢個。咁 the shortcoming 香港嘅 system 或者英國嘅 system 或者美國嘅 system 都係啦，即係我哋用嘅 resources 俾一份醫生嘅人工俾resident。咁佢嘅 job 咧就係要 make sure 佢哋學到足夠嘅嘢去 becoming a specialist in science。At the same time， 你要 provide 足夠嘅 service 去 satisfy the hospital authority。咁呢個有一個 shortcoming， 即係你唔可以話我要做 training， 我就唔去 clinic， 唔去之後進去廚房，呢個係唔可以嘅，因為你嘅責任要 pay partly is because you do your morning walk and your clinic。OK， 咁 Malaysian system 咧就係一個Ministry of Health funded 嘅 program， 就係6年嘅。咁佢嘅 training program 都好全面嘅，就係有2年係喺個University of Malaya 喺Malaysia 嘅北邊，就係呢個咧係 purely supernumerary 㗎啦。咁佢嗰2年咧就係學嘢跟 neurologist 學ICU 同埋點樣檢查病人得最有效。咁2年之後咧，先至做一個 service 嘅 neurosurgeon， 係喺啲吉隆坡或者一啲大嘅 General Hospital 嗰度做。咁嗰度就真係要捱世界啦，要 on call， 要做手術，要睇 clinic。咁呢個咧就係因為 Ministry of Health 俾錢請你就要 provide 呢個 service。咁你有2年攤完就要捱世界啦。所以咧 that is the system in Malaysia。咁 Malaysia 個 system 係最新，咁但係經過Peter Black as a president of the World Federation， 佢揾人 assess 過，佢呢個 first author 都係佢嘅 chief president 嚟嘅。咁 assess 過之後咧，其實最後俾分咧最高分嘅咧就反而係 Malaysia 20分 over 40。咁我哋香港我就爭咗1分，就排第2啦。Europe 因為其實冇一個 national 嘅歐洲其實好特別嘅，佢冇一個 national 嘅 accreditation system 嘅。So this is when you talk about training program 嘅考試嘅 assessment 就係呢個係。咁頭先我哋講過嗰個 Towers 啦，就British system 其實都轉咗啦，同我哋當年我哋香港嘅 system 其實就係等於 British system 10 years ago。咁佢依家轉咗咧，就要做2年 houseman。咁就喺呢段時間就唔使你考試，但係你嚟 interview 嘅時候，如果你表現好 ，showing that you are a good doctor to the patients， 咁佢就會收你啦。咁但係其實都好難嘅，因為佢 interview 幾十人，100幾十人，咁就佢只係收15至20個1年，咁佢係 national 嘅，即係England、Scotland and Ireland， 咁連 Dublin 嗰度都係包括埋嘅，咁所以佢係收有時佢收15個，收20個，咁我都唔知佢個 number 點定嘅。咁佢收咗之後咧，就即係每成10年咯。咁佢做嘅嘢咧，佢學個 rotation 嘅嘢咧，就係會係唔包括 general surgery 嘅，咁所以唔包括 general surgery， 唔包括 orthopedics。 就全部都係 neuroscience， 咁即係包埋 neurology 同埋包埋 neurophysiology， 咁個 difference 係咁樣。咁所以依家 British system 同埋 American board 個 system 咧都冇 full time 嘅 general surgery。咁其實依家香港就唯一一 neurosurgery 個 training program 係有，我哋係要做 full time general surgery 同埋general orthopedics 嘅。咁所以咁 American board 最近就轉咗。由一個2年半嘅 clinical component 改咗做54個月，都唔係最近啦，即係改咗成10年㗎啦。咁但係增加咗之後咧，就我去佢哋嗰啲senior neurosurgery society meeting 咧，咁佢哋多咗 clinical component， 因為其實我冇咁多嘢教你喎，因為佢其實佢冇 rotation 嘅，佢係喺翻一個 unit 嗰度。咁就佢哋嘅長處咧就係做手術做得好純熟，就係用一個方法做一個手術。咁因為佢跟嗰個師傅都係跟幾年都有跟嗰個師傅嘅，咁手術做得好好，但係就一招啦，就係識做咁多嘢嘅啫。咁所以佢依家多咗 clinical year， 咁佢哋就揾地方去學另外嘅嘢，咁佢哋就會剩餘嘅時間咧就會去揾所謂啲 fellowship 可以係 pediatric neurosurgery， 可以係頭先阿 Leo 講嗰啲endoscopic 嘅 neurosurgery， 或者會用1年嘅時間去學，或者2年嘅時間去學endovascular 嘅 neurosurgery。咁呢個就係美國依家做緊嘅嘢。咁就我諗就差唔多啦。咁我講到呢度就都希望大家會選擇 internship 嘅 rotation 都可以揀 neurosurgery 係會有呢著數嘅。OK。就呢啲係啲公仔係我做 external examiner 嘅時候考一啲物理，咁呢個咧就係我喺斯里蘭卡考第一次 international FRCS 嘅時候，咁你會見到咧嗰啲 examiner 喺呢度啦，個考生就喺呢度啦，你見到即係個 candidate 就做小頭髮個，so they just more mature。
其實有咩問題？
中大呢邊啊，港大嘅 curriculum 就真係揀嘅，即係我哋已經聽係4揀2，咁裏邊咧即係4個係一個係呢個啦。咁嗰度如果你揀咗就會有1個禮拜 attach to neurosurgery。咁我哋都好似教授咁講，都希望啦即係吸引到你哋揀 neuro module 啦。咁internship 一樣啦，你畢咗業咧就又會 take 你要去4個 rotation 啦，每次3個月。咁咧就 neuro 都有得揀，咁但係我哋有7個 neurosurgical centre 喺香港，有2個咧係 University Unit， 就呢度啦，同埋瑪麗醫院啦，即係香港呢度 CU。咁你應該點揀嘅咧？如果你想做 neuro 嘅嗰6個禮拜 Houseman 咧，咁你咧有2個 choice， 一係咧就揀所謂嘅 neuro bundle。OK， 即係同 HA 同 headquarter 申請，應該係應該係有 intern board 嘅申請。咁咧，如果你揀 neuro bundle 咧，就會所謂7間醫院咧都有機會派到嘅。咁咧就不過，如果你想揀瑪麗同埋威爾斯嘅 neurosurgery 嚟做咧，就你咧就要報瑪麗同埋威爾斯嘅 surgery 嘅 intern， 即係嗰個 choice。咁瑪麗嘅可以 correct 講 ，CU 呢邊係點咧？你報咗 surgery 係有20個 houseman 嘅 vacancy， 咁你入晒佢之後咧，我哋就會再喺個 department 裏邊咧，再問你哋個 preference， 你呢3個月你哋想做乜？因為我哋都分咗9個 team 嘅，即係1、2、3、4 general surgery 啦，跟住頭先啲雜需啊，例如 thoracic 啊、pediatric surgery 啊、urology 啊、plastic 啊、neurosurgery。咁我哋都會 according to 你個 preference 啫，我哋就會知道咧去配對。我如果有人 take neurosurgery 第1咧，我就會一定會即係 accept 佢嘅，即係除非你話我哋一次只可以收一般2個啦，除非多過2個啦。咁所以咧就呢個希望你哋清楚啦。我諗瑪麗都一樣嘅，瑪麗嘅 neurosurgery 嘅 houseman 都應該係經 surgery 派出嚟嘅。
我哋嘅
係咪？或者你
我做過瑪麗 surgery， 咁我係夜晚翻嚟要 surgery， 所以都係經其他都冇 surgery 後嘅。PM 都 像 surgery 幾幾數佢個 team 咧講
係咪？咁有冇俾你睇？
有㗎。
係咪？因為依家嗰啲 bundle 咧都我都唔係，因為有陣時我哋都會有第三個 houseman 咧，就係經 neuro bundle 嚟嘅，就嗰陣時喺 Interpol 爭取嘅。咁你揀 neuro bundle 嘅就我意會到就係即係7個 centre 都會派。例如，但係有啲 centre 嗰5個X-ray centre 咧，佢就唔係次次都有 houseman 啦，佢可能有啲 centre 一年係得2個3個會去6個月，咁再 pair 會可能將到上月。咁呢個即係希望清楚啦。咁跟住就會做 BST 啦。咁你咁又點咧？如果你想做 neurosurgery，咁咧就更多唔同咧，就係我哋呢度同其餘嗰6個 centre。其餘嗰6個 centre 咧，佢哋都係自己可以 recruit BST as neurosurgical basic surgical training， 即係你係 under neurosurgery。OK。咁我哋呢度係點咧？我哋都同 Department of Surgery 仲係一齊嘅。咁可以兩個做法嘅一樣，就係你係去申請 Department of Surgery 去做。咁咧就我嗰個年代就係㗎啦。我入去做 BST 咧，我都未諗掂，或者我都未知道想做乜，就入咗 surgery， 完成咗個 training， 即係依家就2年。咁完成咗之後，或者個過程裏邊咧呢2年，你想做咧就即係 approach 即係 neurosurgical team。咁我哋喺 high training intake 嘅陣時咧，就即係考慮啦，即係或者去考頭先教授講嗰個 intake 嘅 test。咁當然啦，又喂我好有興趣喎，依家又知道咗其實個 pathway 係咁咧，你可以直接即係聯絡我哋，聯絡我咧，或者我哋我做 intern 我想 join neurosurgery， 咁都 OK 嘅。咁我哋就睇下邊一個辦法會係最可行啦，或者係經 surgery 入啦，還是我哋都好似可以好似其他嗰6個 team 咁樣6個 unit 咁樣直接即係我哋都有一個張醫生咧，就係經呢個 pathway， 即係去 intern 之後咧就入 neurosurgery。咁當然即係個情形就都係去到考完試啦，2年後啦，你都真係中意做。我哋又覺得你合適，咁先至 HST 為準，即係 high training 咧，就先真係 start 你嗰個 neurosurgical 嘅 career。咁跟住後邊有啲教授講咗啦，即係5年 ABCAA， 跟住考個 conjoint exam， 咁咧就成為咗 specialist。咁跟住咧就都未完㗎，因為咧咁就可以喺我哋呢度咧，或者喺2間大學咧就有2個 pathway 嘅，就係可以做 academics 啦，academics 嘅 neurosurgeon 啦，或者係大部分係 HA 即係嘅 neurosurgeon 啦。咁頭先講嘅就係好多 subspecialty 啦，你繼續要進深嘅 exit 咗咧，其實都係 the beginning of the end 嘅啫。我哋其實嗰陣時先係真正咧 exit 咗，即係真正去學到頭先咁多位講嗰啲咁 highly skillful 嘅手術嘅。咁希望即係大家都明白，咁都即係清楚嘅話咧，咁就會好啦。大家即係會配對真係中意做嘅，或者我好清楚我唔會中意做呢個 surgery， 我哋好相信佢哋。有冇咩問題？好，希望大家咧都 follow、like 同埋 subscribe HKSAN。